Varicose veins can be unsightly, and many of us try to hide them. If that doesn't work, some of us may try to cure them. Some methods include losing weight or wearing looser clothing, elevating the legs, and reducing one's time on their feet in order to ease the pain and prevent the veins from worsening. Some try compression stockings, which squeeze the leg to promote more efficient blood flow. These can be purchased at pharmacies and medical supply stores. But sometimes those efforts just don't do the job. That's when vein treatments from a specialist can yield more favorable results. Dr. Charlie Hahn of Veins, Florida explains the options and procedures of vein treatments.
For the vein treatment, a lot of patients think it's not medical problems, but I think I see a variety of complaints. And we have a variety of treatments for the vein patients. Traditionally, medicine, patient come in with one set of problems or several sets of problems, and then you will usually, you can either treat the patient or refer the patient somewhere else. For the vein patients, they tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. And I think nowadays the treatment is evolving, and more than some other traditional medical problems. People can live with varicose veins for a long time. They tend to have a long-lasting effect on patients, more so than some of the medical problems, in which either you don't have symptoms or the symptom goes away after short treatment. But for varicose veins, it can come back years later, and it's been with the patient for a long time. Certainly, it can cause a lot of life-changing for the patients. My experience is it tends to come back in a different area, but it takes a little longer for the varicose veins to come back than spider veins to come back. It depends on the pathology of the disease. Let's say if a patient has valvular disease in the vein, after ablation, after removing the varicose vein, they tend to have a long-lasting effect. If the patient that comes see us, they have lots of spider veins, we didn't really find any reflux in their saphenous veins. They tend to be short-lasting. It might eventually come back, maybe years, maybe 6 months. It usually takes about a week to 2 weeks once all the incisions healed up, and they can see a difference. Those procedures tend to be less invasive, and patients tend not to spend a long time in the hospital. And usually they're fairly happy after treatment. I think it changed their lifestyle for the better, and decreased their pain, and decrease their awareness of the varicose veins. I think it provides much better feedback to me.
If you'd like more information on this story or contact information for Veins, Florida, just click on the Vein Treatments story link icon on our homepage at yourhometownhealth.com.